Good morning. Welcome. This is our first State of the System address. As you can see, we are part of a system. And what do you think about the new logo? Great. Hey. The board approved that last night. We're very excited about that. We are not changing our name. We are still Johnston Health. But this will be our new logo. Now, everything's not going to change overnight. It's going to take a while. But this is what we're working towards. And it's going to show that we are part of the best system in the state, the UNC healthcare system. And David Strong, there, who's the CEO of Rex, and works with us on system issues. He'll be talking a little bit later on and talk about the system and what its size and who all is involved in it, and why it's important that we're a part of that system. So we'll hear about that in a few minutes. But again, welcome. I have been told I have to stand here because we are recording this. This is on videotape. And so I tend to walk. And so they've got me chained to the podium. Also, I want you to know that we have our version of the Johnson County teleprompter. We have note cards that we can refer to from time to time. Hopefully it won't break down and I won't lose my place. But anyway, so again, thanks for everybody for coming. January is a time when it's a great time for us to look back and think about things that we've accomplished and things that have been important over the past year. And so we wanted to do that today. And we also want to talk a little bit about what's planned for the future. What are things going to look like for us in 2014? So that's what we're going to do. I want to say just to start off with, and these are my I have to give statistics. It's just part of where I come from. But over the last year, we had over 8,700 admissions. We're continuing to grow. And our emergency departments between Smithfield and Clayton saw over 77,000 patients. That's huge. And as you know, the emergency department is a major source for our admissions. Over the last year also, we did about 6,600 surgeries. That continues to grow. Over the last 3 years, we have really grown. There, about 4 years ago, we took a little bit of a decline, but since that time, our surgeries have really grown. And then also over the past year, we've been able to play the Brahms Lullaby about 1,300 times. So we've had about 1,300 deliveries. So that's it. Those are my statistics. All right, just showing what kind of growth and how busy we've been. So over the last year, probably we've done some very significant things, and of course, the first thing that comes to mind is the first thing that you saw when you walked in the room, and that is we have chosen to become a part of UNC Healthcare. We are very excited about that. That process, as you recall, started back in November of 2011. It was a very deliberate process, a process where our board of directors vetted with several options, talked about the pros and cons, and really determined that our choice would be the UNC healthcare system, and we're very excited about that. The opportunities for both clinical programs, operational efficiencies, and things that we're going to gain from that are just unbelievable. And I'll talk about that again in a few minutes. The other thing that we accomplished over the past year, is that we became chest pain certified in 2 of our emergency departments. Both our emergency departments became chest pain certified. Now, what does that mean? It means that patients who come to our organization are going to get the best care if they come in and present with chest pain. That means that we're going to follow the best practices and that we're going to save lives. That's what that means. We had we had some people here a couple of weeks ago, and they visited with us. They were looking at all the different areas of the hospital, and these were people from the state. You all know about that. But they came in, and one of the surveyors said to us, "Wow, if I have a heart attack, I want to come here." And the reason she said that is because she knows from the time she walks in the door, if she's having chest pain, she's going to have an EKG in less than 2 minutes. That is what we've accomplished with that program. We've also, our door to transport, the time it takes to get a patient into an ambulance that we need to transport is on average 32 minutes. And then the time to get to a cath lab is 87 minutes. Best practice is 90 minutes. So we're beating all those goals. So we're very, very happy about that. And I want to talk about, tell a story, because it's not just about statistics, and it's just not about processes. It's about our patients. And I want to recognize one of the patients that we have with us today, Gordon Woodruff. Gordon, would you stand, please? So Gordon and his wife, Debbie, please. Thank you. This is Gordon Woodruff. I have it in the seat. Gordon was going to work one day, felt a little ill, and he had some pain, and he said, well, I think I need to stop off at the Smithfield ED. And we're very happy that he did, and I think he is too, because when he walked in the door, he was definitely having a heart attack. We got him into an ambulance, got him transferred. He was in the ambulance within 22 minutes. However, on the way to the cath lab, they had to make a stop because he went into full cardiac arrest. They had to pull over to the side of the road and perform CPR. Then they took him revived him, shocked him, got him on the side of the road, and then got him up to the cath lab. He was in the cath lab within 48 minutes of the time that he arrived at Johnston Health, where he's very happy that we are here, and he agreed to come because he wanted us to tell his story, because it's also good for us to realize what we do. And I'm just going to steal from David. I apologize, David, because I heard him say this the other day. We just have to separate sometimes the business of healthcare from the work that we do, and that's what it's all about. And I want to thank Gordon, Debbie, for being with us today, so that we can see and connect to some of the work that we do. Thank you very much. Thank you. We had a similar incident up in Clayton. A gentleman by the name of Jason Hudda. Jason was 29 years old. And he was at Johnston Community College giving a presentation in his biology class, and he was feeling a little pain, and he didn't know quite if it was the fact that he was giving a presentation or something was wrong with him. But by the time he got home, he was in a full sweat, and his wife said, I'm going to take you to the hospital. You know how wives are. Anyway, she took him to the hospital, and yes, he was in arrest. They did the EKG. They actually had to shock him 6 times to bring him back around, and then they got him transported to, again, the cath lab, and he was able to be in the cath lab also within under 50 minutes. And so again, when he came into the emergency department, he looked at the nurses and he said, "I have 2 children. Don't let me die." And that's what it meant. And that was and he was able to be with the Clayton staff the other day, and it was really great, again, for them to interact with him and talk to him and his family, and how much they meant to him and how much he meant to them, the both of them, and how they felt about that. And also, Kenny was here with Mr. Woodruff and his wife. Kenny was actually the one in the ambulance who performed the CPR. And Kenny, anyone else here was involved in that care incident?
Lisa took care of him here in the emergency room.
Okay.
And I taught Lisa. Lisa was one of my students. I just found that out this morning. I didn't know that this morning.
She's a wonderful teacher.
That's great. We also added some services this year with the gastroenterology. As you know, Dr. Majithia joined us, and with him he brought some new services, ERCPs, And I know that there's a Miss Alford that's very happy that he did, because she had been in pain for over 2 years with various things and gone to several doctors and just couldn't seem to figure out what was going on with her. But when she finally came to see Dr. Majithia, he was able to perform an ERCP on her, recognized her need for gallbladder surgery, and she's been very, very pleased about that. When Dr. Majithia came, we thought that we were going to do about 23 or 24 ERCPs in the first year. In the first 4 months, we've done 54. And he was going to be with us today. I don't think he's with us today because right now he had 19 procedures today and 12 patients to see in the hospital. So we want him to do that. So that's we appreciate again his being with us. We also added Dr. Rao, a rheumatologist, which was the first time that we've ever had rheumatology services in Johnston County. Prior to that, people were having to travel to Greenville or Greensboro or Raleigh, and also having to wait weeks and weeks for appointments. But now he's seeing about 10 patients a day, and they're both, he's very happy here. It's interesting, both he and Dr. Majithia now are board certified. When they arrived, they both had to sit for their boards, and they did, and they both passed, so we're very happy with that too. So congratulations to both of them. Can't get in front of a group without talking about the expansion in Clayton. I mean, that's the big thing. That building in Clayton, finally, we have started that building. It is up out of the ground. If you haven't been up there lately, you need to go by. It looks like a hospital. There's the steel is all finished. We're putting in decking and flooring, and Kyle gives me details every week about the steps. We are actually 20% complete with that construction, and we project that we'll be in that building by this time next year. January the 5th is the projected completion date. So we'll start moving things up there probably around in December. So another thing we did this year is we were able to recruit a wonderful gentleman, if you haven't met him, Dr. Don Pocock. Don is our Vice President for Medical Affairs. He has really hit the ground running. He's gotten involved with a lot of the staff and a lot of the physicians. He's helping us address a lot of concerns that sometimes doctors and administrators, they talk to each other and sometimes they don't hear each other. But Don has bridged that gap, and he's going to help us a lot with a lot of issues. We're very excited about that. And then also we continued this past year with our lean program. In the emergency department, we focused on some lean initiatives and have improved our patient flow. And also on the inpatient side, again, decreasing our length of stay, improving some processes there. We believe that our length of stay, last year we were able to save over $1 million just because of our reduction in our length of stay and able to get patients treated more quickly and more efficiently. But I'll tell you, one of the stars of this year has been our behavioral health program. This past year, as y'all know, for many years, our behavioral health program, a high need for this area. Unfortunately, that financially, it's a hard program to run and manage, and we were losing quite a bit of money on that service. This year, with some help, a lot of help from people in the community, politicians, in fact, we were able to get the state to recognize us as they do other behavioral health units and pay us in the same way that they were paying other behavioral health units. And you've heard me talk about three-way funding. So we were able to get that funding, and so now the behavioral health facility, we were able to expand services in that department, inpatient behavioral health, and break even. That is a great step forward. And Dr. Verghese and the staff of that unit are to be commended for all the work that they did. It's been a lot of work, and they've really stepped up to the plate and helped us really improve the services of that area. And then finally, I'll just talk briefly about our success as a business. And we are a business as far as our revenues and expenses, but over the last year, our income grew by 77%. A lot of that has to do with some new services that we've added and the growth in Clayton. We also have financial improvements that we've done within the organization, and we closed the year with about a $2.8 million operating margin. That's the best margin we've had in the past 5 years. We did that again with growth in Clayton. Their growth grew about 16.5%. And then also we saved about $1 million here in Smithfield because of the focus that each of you have had on again, productivity and expense reductions and consolidations. We have, over the last 5 years, and we needed to do this because y'all remember 5 years ago things were a little grim, but over the last 5 years, we've taken $18 million out of our system in expenses. We've reduced the cost to our patients by that amount of money. So that's something we all need to be very, very proud of and very happy that we're able to achieve that. Now I want to talk a little bit about 2014. What's ahead? Well, first we're going to finalize our agreement, our affiliation with UNC. You know, we still haven't closed on that deal. But we hope to close within hours. We really do. We are still waiting from HUD's final approval of the transaction. They have no objections to the transaction. It's just that they have to go through a lot of legal hoops to get that done. And hopefully every day they say tomorrow, tomorrow, tomorrow. I'm tired of singing that song, and but we are going to get there any day. But you know, that has not kept us from working with UNC. As you know, in November, they began managing our organization, and because of that, we've been able to look at a lot of things like purchasing, ICD-10 implementation, marketing, physician recruitment, IT. We've saved a lot of money with IT equipment that we're able to get through their programs. We're talking all types of operational improvements. We have a meeting actually this afternoon where we sit down and talk with the leadership, where they say, now we've helped you with this and this, and we're doing this and this, and it's a great event, and it's going to be a very good thing for Johnston Health. We're also with UNC preparing for the Affordable Care Act and the population management that will have to be done. And that's, again, one of the reasons we joined with the UNC system. It's because we knew that we were going to have to be involved in population health management as part of the Affordable Care Act. And we have started the road work for that. So we're recruiting physicians. Primary focus is going to be on primary care, family practitioners, internal medicine. We've already got an internal medicine physician joining us in the next few months. We're also focusing on general surgery, neurology, psychiatry. We are helping to recruit some psychiatrists, and neurology. We have a neurologist scheduled to be here again in a couple of months, and we'll be recruiting a second one once she gets here. So continuing to grow in those services. The Clayton building. Clayton, I talked about this time next year we're going to have to be in that facility, and it's going to be more than building a building. We've got to put service into that building. We've got to put people into that building. We've got to put processes. We've got to put operations into that building, because the building doesn't do anything. It's the staff and the care that goes on that makes it work. So everybody in this organization is going to be involved in getting that facility up and running. Jackie's not up there by herself with her team doing it all. It's going to be all of us working together to get that facility open. We're going to continue with CPOE. We're currently at about 60 to 65% of our orders are entered electronically. We need to get that up to closer to 100%. So we're continuing to work on that, and heard Dr. Ryan last night at the board meeting talk to our board members about her re-emphasis and refocus on that and moving that forward. We have some other services that we're going to work on enhancing over the next year. We want to become stroke center certified. We also want to become certified for cardiovascular disease. And we want to get our cancer certification, cancer care certification. we're also moving forward on our diabetes program and hopefully move towards certification with the diabetes program too. So we've got a lot of improvements that aren't big buildings and big technology, but a lot of improvement in care and care processes that we're going to be focusing on over the next 12 months. I'm going to introduce David Strong, the CEO of Rex, and he's going to talk about the UNC system.
Well, happy Friday. You glad it's Friday? Yes. I am, without a doubt. Also, just thank you to Gordon and Debbie for coming and allowing Chuck to share your story. It is, without a doubt, as he said, important for us to think about the real work that we do. It is easy with all the pressures, whether it's the Accountable Care Act or ICD-10 or value-based purchasing or probably living up to Eddie's productivity standards, whatever those are, take away from what's really important. And what's important is caring for patients. And so your story helps us remember that. So thank you very much. Thank you. How many of you have kids? Yeah, all right. Well, I've got 4 kids. So usually I can't talk without telling a story about my kids. But this one is one of my favorites. It's an older story. I have 3 sons and a little girl. And when my second oldest son was about 4th grade, he was home doing homework. And he's at the dinner table, and he looks at my wife and throws his hands up, and he says, adults have it easy. And, yeah, that was the same response that my wife gave him. And she looked at him, and she said, Eli, she said, I'll have you know that I went to school for 16 years. She's a BSN nurse. And she looked over at me and said, Daddy went to school for 19 years. And Eli looks at her, looks back at me and says, Daddy got held back, didn't he? So kids are humbling. I tell the story to tell you that from UNC's perspective, we are humbled to have the relationship with Johnston Health. We are excited about the relationship, and we are thrilled that we were chosen as your partner and want to make sure that we live up to the standards that you have for us. And so thank you for the opportunity to work with you. What I'm going to do is just share a little bit about the healthcare system. I don't know about you, but changing a logo is sometimes painful. At least it is for me. I've been at Rex. I've been the CEO at Rex for 10 years, and Rex didn't change its logo till a few years ago. And frankly, I didn't want to change it. I kind of liked the purple, and but we did these community studies, and kind of going off track now, but we did studies before we changed the logo and got perceptions of the community. And what the community told us was, Rex, the great patient satisfaction, you're very soft with people, but your technology's not very good. And that was the furthest thing from the truth. I mean, we had invested millions of dollars in all kinds of new digital ORs and you name it. 2 years after we changed the logo, we did the same perception survey, and guess what? We still had good patient satisfaction, we were still lovey, and our technology had amazingly improved. And so the halo effect of having the logo is good. The other thing that it helps Rex, and I hope it helps with Johnston Health, is that when people move into Raleigh or when people move into this region, a lot of times you're new. You come from another state, and you've not necessarily heard of Johnston Health. You're not sure what a Rex is, but you've heard of UNC. And so there is some credibility that comes with the logo. And I could tell you stories from some of the other affiliates that have used that in physician recruiting. But the important thing is to remember and why we have joined with key facilities. We've turned down more relationships than hospitals that we've partnered with. And that's the reason we've partnered with folks is the culture. And so what we don't want to change, and I don't want anybody to allow us to change, is the culture. I don't want to change the culture at Rex. I don't want to change the culture at Johnston Health, because That's what makes each of these facilities special. And together, I think we have a wonderful culture. Some of the common questions that I get about the healthcare system is, well, why have you grown so fast over the last couple years? And the quick answer is in 2011, we were a couple hospitals. We were UNC Hospital and Rex. And we needed to make a conscious decision. Where are we going to join somebody else, or where are we going to become a system? And so the decision was made, we're going to become a system. And so that is why we've grown. The other question is, well, how big is big enough? And right now, everybody on the screen, we're about a $3.2 billion net revenue healthcare system. We have no desire to be the largest healthcare system in the state, but we want to have enough scale to make sure that we survive. At $3.2 billion, we are the third largest healthcare system together now in the state. The first is Carolinas, which is based in Charlotte, which is an $8 billion system if you add Moses Cone in with them now. The second is Novant, which is a Winston-Salem-based healthcare system. Then again, UNC, and then the fourth is Duke at about $2.5 billion. So it gives you a sense of really where we are. I think you also have a slide that you can take with you on this. But the other question I get is, well, where are the hospitals located? And you can see there's a good presence across the state of North Carolina. The yellow circles are where hospitals are. And then the yellow circles with slashes through them are hospitals that are currently under construction. So you can see there's 3 hospitals that are under construction. And then the soccer ball, yellow soccer ball looking, that is obviously Nash Healthcare System, and they've announced that they will join UNC Healthcare System, but that will occur in April. And so that's the example of the hospital. So a total of 11 hospitals once the facilities like Clayton are built. The green dots represent physician practices. They're not individual physicians. One dot may represent 30 physicians, for example. If you totaled up all the number of physician visits, and these physicians are actually employed physicians, they see over 2 million patients a year. Total of the hospital beds across this system now are 2,700. Do over 100,000 surgeries, and I could go on with the numbers. But it is a system that also is about excellence. This is just an example of some of the awards that hospitals across our system have been given over the last year. You're on this slide as well, the Press Ganey slide, where you're a top performer. But inside our system, we have a Nobel Prize winner at the medical school. We have multiple hospitals that are Magnet accredited. We have hospitals that have been ranked as the top 50 in the country. U.S. News and World Report have ranked our hospitals, not just the medical center in Chapel Hill, but also other community hospitals, as the best. And one of the ones that I like most is the best places to work. My desire for all of our facilities is that they are the best places to work, where people can come and, yes, you work hard, but you leave at the end of the day and you feel that you've made a difference and that you have work with purpose. Because certainly, as we heard the stories this morning, our work has great purpose. The final question that I get a lot is, okay, well, what areas are you going to look to work together as a system to try to get synergies, both strategic savings as well as financial savings? And the way that these things are determined are actually the various CEOs across the system, as well as the COOs, the CMOs, have meetings. The CEOs meet monthly and talk about the areas where we can work collectively together to essentially do better for the system. And so when you read back office functions, that's financial. And so the idea there is, what areas in the financial services can we work together closer on? And an example I would give is, one of the things that we would like is, we'd like to have a consistent policy for how patients without the means to pay, what their discount is. So you don't show up in Smithfield and the discount is $100, but you show up in Raleigh and it's $20, or you get the picture. And so what is a common financial assistance policy across the system? So we will look at policy, but we'll also look at areas to work together. Purchasing is another. When you get as big as we are now, you no longer buy by the box, you buy by the truckload. And so when you buy by the truckload, you get the extra Sam's discount, if you will. And so that is part of what we will look for. Under HR, the goal there is almost that same Sam's discount idea, is with as many coworkers. We have over 20,000 coworkers across the system now. How can we provide a potentially even a more competitive or better benefit platform at a lower cost? And so that's the goal behind HR. It's also, I was asking one of the forums the other day, well, what if I wanted to transfer from Johnston Health to Rex, or what if I wanted to transfer from Johnston Health to Pardee? Would I get the same, would things be the same? The answer now is no, because each facility is very different. What we're trying to do is figure out how to make those consistencies. Information services, I think, is obvious. We want to have information that we can compare hospitals across the system. Marketing communications, that's really at a global brand level. Still locally, the way you market in Johnston is different than the way you market in Hendersonville, for example. And so that will still be targeted and different. And then legal. We want to make sure that we're looking at things from an attorney perspective consistently across the system. So that's really the overview, the quick overview. I'd be happy to answer any questions, but before I do that, I'll just end where I began, and that is that, again, thank you for the opportunity to work with you. And again, we are humbled with the opportunity. And so happy to answer any questions. And Chuck, too.
Questions? One.
Mission, vision, and values, are they going to remain the same, or are they going to change?
It's a great question, and I'll ask Chuck to jump in as well. But one of the UNC healthcare systems, what they say is, they want to be the leading public academic medical center in the country. UNC Medical Center may still have that, but that's not a great calling for Rex or for Johnston Health. They also talk about leading, teaching, caring. That's not also, it's good, but it doesn't fit the entire system. So one of the things that we're in the process of doing now is determining what is that system vision and mission. One of the things that we will roll out soon that Chuck and others have worked on is consistent pillars or areas of focus across the healthcare system. And so when we talk about certain things, we're framing them in the same way.
What we'll be doing is looking at the system as far as how the mission, vision, values, how we would fit into that. I think values are probably going to be somewhat consistent across the organization, but our mission today is very different than UNC's mission. And probably will stay more local in its intent. So we'll certainly look at that, but it will feed into, and you heard earlier today, or at least the directors did, about our pillar goals and how we're reframing those pillar goals. That's nothing new for us, but just how we're reframing them and how we are going to align ourselves throughout the system so that we can communicate with each other and say, hey, these are the things that we're working on together. So,
and just one other piece of that, I would add, there may also be new things that you might want to become a part of. Research, for example, you probably do some research now, but there's the opportunity to do a lot more. And the example that I would give is you will see types of cases here that they'll never see in Chapel Hill. Example from Raleigh, we see hundreds, unfortunately, of early stage breast cancers. Okay, they don't see that many in Chapel Hill because by the time the patient gets to Chapel Hill, they're stage 3, stage 4. And so from a research perspective, we're actually collecting in Raleigh more early stage breast tissue for research to look for the cure than they do in Chapel Hill. So we are aiding looking for new treatments, new diagnostic treatments, and yes, and a cure. And so there may be things like that we'll have access to and you'll have access to here that you've not in the past. So that process has to go through.